This is the Chris Berry Show. Expert information on wealth, estate, and tax planning for the second half of life. Information that you can understand. Here's your host, Chris Berry.
Welcome to the show. So this week, just like every week, we're going to talk about or start the show off with a positive focus, something positive that happened over the previous week. This week, I'm going to share that I was out for a day or two getting at a training, updating what's new in the Medicare world. And so today I thought I would share some just information on Medicare. It's something that every year there's new plans that come out and changes, and it's important to understand how it works because anyone over the age of 65, 9 times out of 10, this is where your health insurance is going to come from. So today what we'll cover is some Medicare basics. We'll talk about Medicare supplements and why those are important to consider. We'll talk briefly about prescription drug coverages and some of the important dates with Medicare. Medicare is something that can be very confusing, and it's something that everyone needs to understand because they need to make some choices. And some of these choices, they only have kind of once-in-a-lifetime opportunities as well. So you want to make sure that you get your choice with regards to Medicare right. So that's what we'll cover today. And if you do have, if something's unclear or you have questions or want to see how this applies to your situation, feel free to give our office a call at 844-885-4200. We do workshops about once a week, and we touch a little bit on Medicare, but I did envision we'll have a Medicare-only workshop coming up just because it is a topic that needs to be addressed. And a lot of times we do our Medicare workshops around open enrollment period, and we'll talk about what that means today on the show. So today we're going to talk about Medicare basics, Medicare supplements, prescription drug coverage, and some important dates around Medicare. But first, why are we talking about this in the first place? Well, because we need to think about the cost of healthcare. So like we've mentioned many times on the show, we focus on 5 key areas in retirement: income planning, investment planning, tax planning, healthcare planning, and legacy planning. So Medicare is an important component of that healthcare planning along with long-term care. Those 2 components are really what we're talking about when we're talking about healthcare planning. Talking about the cost of prescriptions, the cost of if you were to have an event like a heart attack, as well as long-term care costs of needing home care, assisted living, and nursing home care. So those 2 components really make up healthcare planning when we're talking about healthcare planning. And the cost of healthcare in retirement is pretty concerning. And in fact, there's about $3.5 trillion spent on healthcare in 2017, and that's projected to grow about 5.5% per year. And the healthcare premium cost can have a dramatic effect on your retirement, and I see this, it seems like there's 2 things that are just beating the rest of inflation in terms of rates with just skyrocketing costs. One of them is long-term care and healthcare costs, like health insurance premiums. I was reading a recent article that said healthcare premiums are increasing about 239% over the last 20 years, which is crazy to think about versus just overall inflation, roughly about 51%. So we have healthcare costs that are increasing faster than inflation. And the other thing is just college costs. I have 2 young kids, Ryan and Madison, and saving for college and just projecting out what their college cost will be in 10 years is pretty astronomical. So healthcare spending, it's something that every retiree should be concerned about because it's something that could eat away or erode at your life savings. And seniors are spending more on healthcare than ever before. When we're looking at budgeting, in the past, all ages, healthcare typically makes up only 8% of the spending, along with food and beverage, housing, apparel, transportation, entertainment, and other. Versus those 65 years and older, healthcare actually makes up over 13%. And is one of the largest expenses in retirement. So obviously it's a big concern, and that's where Medicare comes into play. because Medicare is the largest health insurance program offered by the U.S. government, and it serves over 55 million people. And it's run by the Centers for Medicare and Medicaid Services, CMS, and it's part of the Department of Health and Human Services. And Medicare is actually divided into three parts, and this is where we get into the alphabet soup that is Medicare. If I were in charge of designing Medicare, I'd set things up a little bit differently, because we're using letters in different ways for different parts of Medicare. So it's really confusing the way that they've set it up. But really, Medicare is divided into three parts. Parts A and B are original Medicare. And Part C, which really isn't sponsored by the government, this is where it's your Medicare Advantage program. And then Part D is your prescription drug coverage. So most people will have A and B and D, or maybe they'll have an Advantage. And we'll talk about that, kind of the differences of why you might have an Advantage versus relying on original Medicare later in the show. But A and B, this is original Medicare. So this is the basics. Part A helps cover things like hospital, skilled nursing facility stays, hospice, home health care. And when I say that, skilled nursing and home health, to a limited extent, this isn't paying for long-term care. This is typically your short-term rehab. So your hospital stays, skilled nursing up to a certain time frame, hospice, and potentially home health up to a certain point are all covered by Part A. Part B covers things like doctor's appointments, outpatient care, occupational and physical therapy as well. So Part A, think of that as hospital insurance. So anything related to hospital stays. Part B, think of that as doctor insurance, covering appointments, that type of thing. That's a good way to think about those too. Now we have Part C. And Part C, as well as Part D, are offered by private companies. So this is where Medicare, it's kind of a combination of federal as well as private options to cover healthcare costs. So Part C helps cover everything that Part A and B covers, and then often covers additional services like dental, vision, as well as wellness programs. And keep in mind, these are offered through private companies. Part C is also called the Medicare Advantage Plan. And basically, it includes Parts A, B, and D into one plan. Part D helps cover prescription costs. So the cost of that medicine over the counter, that's going to be covered by Part D. So most people at the end of the day, with all that said, they receive their Medicare coverage in one of two ways. And the first is they choose original Medicare with Parts A and B, and then they will add a Medicare supplement, and we'll talk about why they add that, as well as adding on Part D, or a standalone prescription drug plan. So most people, I would wager, have original Medicare with Part A and B, and then they add on the Medicare supplement as well as Medicare Part D. Or the other option is that they will choose an Advantage plan, a Medicare Advantage plan from an insurance company, which includes Part A and Part B. And often these include prescription drug coverage as part of the Advantage plan. And so it kind of lumps everything together. So that's kind of one of the advantages of the Medicare Advantage plan is it might be cheaper, but you got to see what it covers, original Part A and B plus the supplement and Part D versus choosing an Advantage plan. There's a lot of things that go into the pros and cons of each one. But with original Medicare, you'll pay a share of the cost. So there is going to be a portion of the cost that you would have to cover with Medicare, original Medicare. For example, your Part A deductible, which is roughly $1,408 per year, that would be out of pocket to you. Likewise, you have your Part B monthly premium plus a Part B deductible of $198 per year, Plus, you have hospital co-pays up to 60 days, nothing. And then you could have $352 a day from days 61 to 90. And then from day 91 to 150, it could be $704 per day. And then after 150 days, Medicare runs out. And then in skilled nursing, 1 to 20 is covered by Medicare. 21 to 100, you have a copay of $176 per day. And then after 100 days of skilled nursing care, Medicare runs out. So that's why we say that Medicare really covers short-term rehab, doesn't cover long-term care. And then also, you would have copays where Medicare pays 80%, but you would still pay 20% for any Part B costs. And when you take into account the average out-of-pocket costs, and this is from 2019, according to Medicare.gov, here's the breakdown of average out-of-pocket costs for a senior in 2019. Your Part B premium is $135 and change. Inpatient care, $38. Outpatient prescription drugs, $328. Dental services, $42. All other healthcare services, $111. So the total monthly cost would be $654. And this is where a Medicare supplement comes into play, because you could get into some situations where the cost could skyrocket. For example, if you were to, and these are the averages for out-of-pocket costs, in good health, the average annual out-of-pocket expense with just original Medicare is $7,850. And that's just in good health. If you had diabetes, it could easily be over $10,000 out-of-pocket cost. Congestive heart failure could be $12,000 or more. If you had a heart attack, over $12,000. So that's out-of-pocket costs. And this is where, and that's just on original Medicare. And this is where a Medicare supplement comes into play. A Medicare supplement plan will help you cover the gaps in original Medicare. And this is through private companies. So if original Medicare is covered through the government, this is where private insurance companies come into play, is to help with the out-of-pocket costs. For example, covering things like co-payments, co-insurance, and yearly deductibles. So unlike original Medicare, a Medicare supplement plan is offered through private insurance companies. And insurance companies are required to offer the same basic benefits for each lettered plan, though they do have the ability to charge different premiums. And that's important to understand, is that all the lettered plans are basically the same, but different insurance companies can charge different premiums for them. And this is where we get into a little bit of the alphabet soup again we have for supplement plans, they're called Plan A, B, D, G, M, N, F, C. We have all these different options, and again, it's an alphabet soup. And Medicare plans C and F won't be available to new people on Medicare. So if you're just now getting onto Medicare, you won't be able to participate in the plans C and F. The Plan F was thought of as kind of the Cadillac plan. You can still maintain your Plan F if you already have it, but moving forward, those will no longer be available. But there is a good alternative, and that's Plan G. Plan G is a different option that can offer a lot of good benefits, and probably the most common plans selected after F are plans G and N, because they offer the most coverage. Plan G offers the second most comprehensive coverage, covering everything that Plan F covers except for the Part B deductible of $198. Plan N is similar to Plan G, but it requires you to pay a $20 copay when going to the doctor and $50 copay when you're going to the emergency room. And if you go to Medicare.gov, there's a lot of great information if you want some more detail on this. So Plan G is a great coverage where basically the only thing that you would pay if you were to choose Plan G, you wouldn't have to pay the Plan A deductible. You wouldn't have to pay the 20% copay on doctor visits or anything that Part B didn't cover. It would cover hospital stays up to 150 days. And if you needed skilled nursing, it would cover the copay you would have between 21 to 100 days. So with that Plan G, really the only thing that you'd be paying for with the original Medicare Part A and B, the only thing still hanging out there would be your Part B deductible of $198 per year, which really provides some good concrete protection against the rising cost of health care. Now, I'm not saying everyone should choose that. Everyone's situation is a little bit different. But just looking at statistics, with Plan F going away, most people seem to choose Part G or Plan G or Plan N. And so with that, we're going to continue the conversation and we're going to talk more about what Plan D is all about. So we've covered Medicare Part A and B, which is original Medicare. And now we'll get into Part D. And remember, Part D is more of a drug plan. And most people, if they have Medicare Part A and B, will have Part D as well as a supplemental insurance. So stick with us as we continue the conversation talking about Medicare Part D.
Hi, we're Madison and Ryan Berry.
Our dad is Chris Berry from the Castle Wealth Group.
The Castle Wealth Group used to be the elder care firm, but Dad wanted the company to be broader in its scope of services.
To not only protect and preserve assets, but to help people grow their assets to prepare for retirement.
As a certified elder law attorney and fiduciary financial advisor, our dad and his team at Castle Wealth Group can help you with lots of important things.
To tell you more, here's our dad, Chris Berry.
Thanks, Maddie and Ryan. Here at the Castle Wealth Group, we can help you put together an estate plan to avoid probate, work with you on a tax plan to keep more money for your family and less for Uncle Sam, and protect you against the devastating cost of long-term care. Our team is here for your family. I invite you to learn more about the Castle Wealth Group at our next free workshop, where you will learn the 3 steps to create a legal, financial, and tax plan for the second half of life. Call us today to register at 844-885-4200.
The Castle Wealth Group, formerly the elder care firm.
Learn more at thecastlewealthgroup.com today.
All right, welcome back. So we're talking Medicare. We talked about Medicare Part A, Part B. Think of Medicare Part A as your hospital Medicare. Medicare Part B is your doctor Medicare. Now we're going to talk about Medicare Part D. Medicare Part D is going to be your drug plan. Part D is all about prescription drug coverage. Part D plans are required by federal law to offer the basic benefits offered by Medicare. I just did the Medicare and Medicaid switch. My clients do that all the time. But we're talking about Medicare. Medicare Part D is an optional prescription drug benefit program intended to help Medicare beneficiaries reduce out-of-pocket drug costs. If you've ever gotten a prescription and wasn't covered by prescription drug coverage, you know that it can be pretty darn costly. And it's a federally enacted program, but it's administered by private insurance companies. So again, this is where we have this weird interplay here between the federal government and private insurance companies, which makes up a lot of Medicare. It's an interesting play between the two. So you usually choose Medicare Part D in one of 2 ways. Either a standalone insurance plan you buy to cover your medicines, which is called a PDP, or as part of a Medicare Advantage plan that includes Part D. And again, so that Medicare Advantage or Medicare Part C typically involves Part A, B, and D, but it's offered by a private insurance company. A PDP is a standalone drug coverage that you would have if you were with Medicare Part A. There's different coverage coverage is available, but you'll pay up to $435 in drug costs before Part D begins to pay anything. After you pay your plan's deductible, if your plan has one, the amount you pay for each prescription is either a co-payment like $10 or co-insurance, which is a percentage of the drug cost of the drug, maybe 25%. If the combined amount you and your drug plan pay for prescription drugs reaches $4,020, you've entered what is called the coverage gap, or what a lot of people call the donut hole. In the donut hole, there will be discounts on generic drugs and name brand drugs. Once you reach $6,350 of out-of-pocket drug costs, then Medicare Part D will begin paying up to 95% of the drug cost. And there you would pay the greater of 5% of the cost, or $3.60 for generics, or $8.95 for brand prescriptions. So it's important to review your drug plan each year to ensure that you have adequate coverage. Even if your prescriptions haven't changed, your plan coverages are reviewed annually and can be changed. Medicare offers an annual enrollment period each year for you to make the necessary changes. So this is where it's important to understand what prescriptions you're taking or planning on taking over the next year and make sure that you have the best coverage for that plan. So now that we've talked about Medicare Part A, Part B, the Advantage plans, and Part D, let's talk about some of the important enrollment times, important dates with Medicare and the Medicare supplements. So first of all, who's eligible for Medicare in the first place? Well, at age 65, you're eligible for Parts A and B, even if you still work. And you might be eligible for Medicare through your spouse, although you still must qualify by age or disability. And you must also qualify for Medicare Parts A and B you may also qualify for Medicare Parts A and B if you're under 65 and have a disability. But typically we see people qualifying for Medicare at age 65. And again, you don't have to sign up if you're still working for Part B. There's a lot of confusion around that. Do I have to start signing up for Part B and start paying for it? Will I get penalized? The answer depends on your situation. Depending on your employer, if you're still working, and the type of employer and the type of health insurance they offer. Really, it boils down to whether your employer is an employer with more than 20 people, then typically with the health insurance coverage they're offering, then you would not have to enroll with Part B. But again, every situation is a little bit different. Make sure to talk to a professional with regards to that because you don't want to be penalized. So most people get automatic enrollment in Part A and B for those receiving Social Security benefits and Railroad Retirement Board benefits. So let's say you retired and you claim Social Security at 62, you're automatically going to be enrolled in Part A and B. And your initial enrollment period package is mailed 3 months before turning 65, and inside of that will be your Medicare card. Now, the Medicare initial enrollment period is the 3 months prior to turning 65, the month in which you turn 65, and the 3 months after turning 65. And if you retire after 65, enrollment depends on when your employer-sponsored plan coverage ends. So that's where, again, if you're working past 65, it may add in some little bit of variability in there. Okay, so again, the Medicare supplement enrollment periods, open enrollment period starts the month of your Medicare Part B effective date and lasts for 6 months. You're a guaranteed issue regardless of health status. And this is super important, is to understand that with these Medicare supplements, there can be underwriting, and you only have one option to be guaranteed issue. And again, the guaranteed issue starts the month of your Medicare Part B effective date and lasts for 6 months. And you're guaranteed issue regardless of your health status. So even if you have cancer and heart attacks, Alzheimer's, diabetes, it doesn't matter. You're going to get your Medicare supplement if it starts the month of your Medicare Part B effective date, or if you apply 6 months after that. So that is the open enrollment period. Special enrollment period is guaranteed issue under certain qualifying circumstances. And not all plans are guaranteed issue in this situation. And then outside enrollment period, you must pass medical underwriting. No guaranteed issue from the insurance company. So for those Medicare supplement plans, and this is what I'm talking about, is you only get one shot of this. Your open enrollment period starts the month of your Medicare Part B effective date and lasts for 6 months after that. You're guaranteed issue regardless of health status. So this is the only time that you have guaranteed issue regardless of health for a Medicare supplement plan. If you were to try to switch plans at a later time, there might be some underwriting, and you might not be able to get the best supplement plan out there at the time. So again, make sure that you put some thought as you're turning 65. And this is, again, one of those things that you don't get a lot of shots at. You only get one chance at retirement. Similar to Social Security timing. You really only have one chance to structure your Social Security properly because you don't really get any do-overs. There's certain exceptions, but once you fire that bullet, it's kind of hard to unfire that bullet. Similar when you're choosing your Medicare supplement plan. You only have one opportunity for this guaranteed issue, regardless of health status. So it's important to do it right. So now with some important dates, October 15th through December 7th. And this is the annual election period for Medicare Advantage plans and prescription drug plans for the next year. So this is kind of that magic time where you look at your prescriptions and see which Part D plan makes the most sense. And then another important time is the January 1st through March 31st. This is the annual disenrollment period of choosing to return to original Medicare. So if you were on an Advantage plan and you wanted to switch back, you can do that during that time period. And so some other helpful resources. If you want to learn more about Medicare, you can go to the Medicare and You Handbook, published by the Centers for Medicare and Medicaid Services. And then you can also look at the Choosing a Medigap Policy, a guide to health insurance for people with Medicare. That also is offered by CMS, which is in charge of running Medicare and Medicaid. So I wanted to cover that. I thought it was important to understand how Medicare works. I know I threw a lot of information at you, but this is one of those areas that is important. There's a lot of confusion about Medicare, and it is important because it's one of the pieces of those 5 areas that we focus on when it comes to retirement planning. Having income planning, developing that income plan, looking at things like your Social Security, your pension, and then maybe drawing on assets to cover your income gap. The second piece is the investments, making sure your investments are invested in such a way that you're comfortable with, that you're not taking on any unnecessary risk. Third is tax planning. So we've talked a lot about the Tax Cuts and Jobs Act and how the Secure Act has really changed the way that we handle retirement accounts and changed the way that we look at maybe that plan to defer paying taxes forever. Maybe that doesn't make sense anymore given our current tax laws, let alone whatever happens in the presidential election. And then fourth is healthcare planning. And that's really what we spent some time talking about today is healthcare planning, not for long-term care, which we've talked a lot about on this show. But no, we're talking about healthcare planning for Medicare, doctor's visits, prescription costs. How can we minimize those costs? Well, the way to minimize those costs, those doctor visits, the prescription costs, the hospital visits, is making sure that we choose the best Medicare plan for us. And there's different schools of thought. One thought is to choose the lowest possible, lowest out-of-pocket in terms of supplement plans. But with the rising cost of healthcare, you could be really putting yourself at a disadvantage. So that's why it's important to choose the best plan that's right for you. And understand with these supplement plans, you can take out a lot of the risk that Medicare Part A and Part B still leaves open to you by adding on a supplement plan and a Part D plan. And then that brings us to the fifth area that we focus on in retirement, and that's legacy planning. So if there is anything left over, how do we leave it to the next generation as efficiently and effectively as possible? And it's important to look at every one of these aspects depending on where you're at in terms of your life. But if you are nearing retirement age, especially if you're turning 65, you really need to put some thought into this question of Medicare and how are you going to look at it. And one of the things that we can do is we can do a Medicare analysis and see if we can save you a couple $100 a month in terms of your Part D options, your prescriptions, figure out if you're on the best supplemental plan that's out there. And especially as we get near the end of the year, this will be even more important during that annual enrollment period. But it is something that we need to understand. And also, we've talked about your Medicare Part B premiums and Part D premiums are affected by taxes and income as well. The amount of income you have coming in annually will help determine what your Medicare premiums will be with regards to Part B and Part D. And this is something that as we're talking about doing things like Roth conversions or pulling money out of the IRA and paying the taxes sooner rather than later, I need to remind our clients that what you'll find is that your Medicare premiums may go up 2 years later because it's kind of weird. They look at, so for your Medicare premium in 2020, the government is actually looking at your adjusted gross income back in 2018. And that's how they're going to base your Medicare premiums. So if you're engaging in aggressive Roth conversions, one of the things you need to take into account is what effect that may have on your Social Security and whether and how much your Social Security gets taxed, as well as your Medicare premiums. And one of the things that we have, it's one of the most handy little guides that we've put together, is a sheet, Key Data for 2020, that lists marginal income tax brackets, Medicare premiums based on your income, whether your Social Security will be taxed. It's probably a sheet that I reference daily. I have it right in my right in my own materials whenever I meet clients because I have to reference that every day. You can't memorize all the different numbers there. And so I can quickly double check my chart to see if we are looking at Roth conversions, what kind of effect will that have on Medicare? Because it's all connected. Everything fits together. And we need to understand the whole system. And if that key data sheet is something that you're interested in, give our office a call at 844-885-4200. Again, 844-885-4200. And just ask Lisa or leave a message for that key data sheet, and we'll mail that out to you. And it's something that we give to any of our workshop attendees. We think it is super valuable, probably one of the most valuable resources we have, because it shows you how in retirement all these different data points fit together. Now stick with me as we get into a question and answer session where we pull questions from our clients.
Madison and Ryan Berry here from the Castle Wealth Group, formerly the Elder Care Firm.
Our dad is Chris Berry.
He's an attorney and fiduciary financial advisor, which means he helps families plan, protect, and preserve their assets.
The entire team at the Castle Wealth Group can help you with lots of important things. To tell you more, here's our dad, Chris Berry.
Thanks, Maddie and Ryan. Here at the Castle Wealth Group, we can help you put together an estate plan to avoid probate, work with you on a tax plan to keep more money for your family and less for Uncle Sam, and protect you against the devastating cost of long-term care. Our team is here for your family. I invite you to learn more about the Castle Wealth Group at our next free workshop, where you will learn the 3 steps to create a legal, financial, and tax plan for the second half of life. Call us today to register at 844-885-4200, 844-885-4200, or visit us at castlewealthgroup.com.
The Castle Wealth Group, formerly the Elder Care Firm.
Learn more at thecastlewealthgroup.com today.
All right, welcome back. So we were talking Medicare, Parts A and Part B. We talked briefly about the Medicare Advantage plan, and we talked about Medicare Part D. All of these are part of that healthcare plan, which is one of those 5 key areas, along with income planning, tax planning, investment planning, healthcare, obviously, and then legacy planning. So we have investments, income, tax, health, and legacy planning. And Medicare obviously falls into that Medicare or that healthcare piece. And it's interesting how these are all connected, and your Medicare premium is going to depend on your income in retirement, which is going to have a tax implications because depending on the amount of taxable income you have, that's going to now affect what your Medicare premium is. So that's why we really think you got to focus on all 5 of these areas. And too often, when we sit down with clients, they kind of have a junk drawer approach of collecting stuff where they have a will and trust from 10 years ago. They don't talk to the attorney. They haven't talked to them. They have an investment guy that sells them stocks or a stockbroker that just sells them mutual funds with high commissions. And maybe they have someone at H&R Block who's doing their tax preparation. But they don't really have a plan. And that's what we really focus on, is we can help you with a piece of the puzzle, or we can put together the whole puzzle for you. Because I think something that we do, our team of now 14 people, is we see the whole picture, how something that we do on the investment side may affect the legal side, may affect the tax side. So we need to put together a plan that's right for you. And we need to understand how these different decisions we make in retirement, like when do we claim Social Security, do we do Roth conversions, they're going to have effect in other areas. And if you don't have a firm or someone that's looking at the whole system for you, that's where you can have some unintended consequences. For example, I was at this the training update on Medicare, and I was talking to another individual advisor out of another state, and he was talking to me about how they had an attorney who set up a veterans a trust to get qualified for veterans benefits. They moved the assets out of the traditional IRAs, and then 2 years later, the family was a little upset because of the Medicare consequences. When in fact, it probably still was a good idea to do that, because with the VA benefit, you can bring an extra $1,000 to $2,000 a month tax-free. But the family was surprised that because of the transitions of the assets, that their Medicare premiums went up. And if the advisor and attorney and really kind of looked at the whole system, they would have let the family know that, yeah, your Medicare premiums might go up in 2 years, but if you're paying extra $100 or a couple $100 a month in Medicare, that's a good trade-off to receive the extra $1,000 to $2,000 a month tax-free from the VA. So in the end, it was still a net positive, but the family was a little surprised. So you got to see the whole system, and that's where a lot of families, when they're coming in, they don't have someone looking at the whole system for you. They might have a good stockbroker who's doing really good in the market, but we don't look at the taxable implications of looking at Roth conversions or pulling money out of the IRAs and putting it into something that grows tax-free like life insurance. You got to see the whole picture, and that's where I think a lot of families need the most help. It's not having the investment guy or a tax preparer. You need to have someone who's looking at the whole system. And that's something we talk about in our workshop. So if you want to see our approach and what we're talking about as it relates to the 5 key areas of retirement, of having an income plan, investment plan, tax plan, healthcare plan, legacy plan, give our office a call. We have workshops about once a week at one of our different locations. Or you can visit us, our website at castlewealthgroup.com. That has a list of our upcoming workshops, whether it's Ann Arbor, Bloomfield Hills, Brighton, Novi, Lansing, Dearborn, we're all over kind of southeast Michigan. So we'll have a workshop that's going to be close and convenient for you anytime. All you got to do is give us a call, 844-885-4200. And in these workshops, usually they last about an hour and a half. And we go over the 5 key areas of income planning, investment planning, tax planning, healthcare planning, and legacy planning. And we do cover some of basic information. We get into some of the tools we use, but also it's an opportunity for individuals to ask questions too, see how kind of all this applies. So if you do have that burning question on Medicare, the workshop would be a great thing to attend. So with that, I wanted to get into some of the questions. We haven't done a good Q&A in a while, and these are some of the questions that have been sent in. If you do have questions, feel free to email us at our firm email, which is contact@castlewealthgroup.com, and just put in radio show question as a subject, and then just go write your question. We might read it on air, or we'll shoot you a response. Or give us a call at 844-885-4200. So first question here, this is from Les. My wife and I had wills prepared by an out-of-town law firm. Can these be included in a trust created by another law firm? So this is a common issue as we see people, like I talked about earlier, that they've kind of accumulated stuff over time. And then all of a sudden they realize they're getting near retirement and they want to try to get organized. And so maybe they have an old estate plan. And I see this a lot, a will or a trust that was done when the children were young. They're flying out of the state for the first time, leaving the kids with grandma and grandpa, and they wanted to make sure that if the plane went down, that their kids would be taken care of. And then fast forward 25 years, haven't updated the estate plan. And maybe you're even out of touch or you're not contacting that old law firm. So the question is, can that current will or that will that was done previously be included or modified by another law firm? And the answer is yeah. We have a lot of clients when they come in, they have an old estate plan, whether it's 10 years old, 15, or sometimes even last year or the current year. And one of the things that we do is we have one of our attorneys sit down and do what's called an estate planning audit, where there's about 10 different areas that we analyze in an estate plan. You might have one of those big, thick binders that are super intimidating to look at and you've never read ever in your life. But understand our attorneys, we've done this thousands of times at this point, where we can flip through there in about 5 minutes and show you exactly where you're at. And then through that, kind of show you some of the opportunities that might be available depending on how everything was drafted. Some of the things we look at is whether that financial and medical power of attorney gives you all the powers you need. Because a lot of times we find that it's just like the financial power of attorney, it's like 3 to 5 pages. It's like a blank check. It's not specific enough. It's missing all of that key language that we need there. Or we look at the trust, and a lot of times when we're reviewing the trust, the distribution pattern says outright to the kids at 25, 30, 35. The problem with this is you're just launching a pillowcase of money at your beneficiaries. What happens if your son or daughter gets divorced at 36? Where might half that money go? It might go in that divorce, right? Or what happens if they pass away? Where might all the money go? It might go to that in-law who we call an outlaw, versus going down to maybe your grandchildren. So these are the things we're looking at when one of our attorneys does that estate planning audit is, what does your current plan say and what do you want it to say? And if there's a gap there, we got to figure out ways to close that gap. Or I see a lot of clients that have a basic revocable trust that avoids probate and controls the distribution, but doesn't offer them any asset protection. Instead, maybe we look at a castle trust that avoids probate, controls the distribution, but now builds in asset protection, protecting you from lawsuits as well as protecting against the devastating cost of long-term care. That's not available in your basic revocable living trust. So that's what we do when we're talking about kind of reviewing that estate plan, is using that tool, that estate planning audit, figure out exactly what it says, and then figure out where do you want to go from there. Next question, and these are kind of organized the legal questions. And again, take everything we say with a grain of salt. Contact your own professional, or I'd recommend attend one of our workshops, see how this information applies to you. Because this is, understand, while I'm providing true information, when clients talk about, well, I heard something on Dave Ramsey or Susie Orman, understand to a certain extent it's financial. Well, it's, yes, it's education, but it's also meant for entertainment as well. And similarly with the show, it's just general advice. So make sure to sit down with a professional, a specialist, see how this information applies to you. So anything I'm talking about here is relatively general. Let's go. Next one. I want to disinherit my children in my will. How can I do this? and this is from Cheyenne. My children are ungrateful leeches. After I've been so good to them, they treat me horrible. I apologize for laughing there, but just the way you worded it, that kind of made me chuckle. And this is something that I see sometimes is that it might get to the point of we need to disinherit someone. And the question was, I want to disinherit my children in a will. And what I would caution is that maybe we don't want to do that in a will. Maybe we want to do that in a trust. Because remember, all a will does is gives instructions to the probate court on how to administer your estate after you pass away. So to be able to disinherit someone from the will, understand you're sending whoever you do want to inherit that money to probate court, which can be time-consuming, costly, and public. And in Michigan, it takes at least 5 months, if not longer, sometimes over a year to go through the probate process. So we know we want to try to avoid that, even if you're disinheriting your kids. So what you might want to do is set up a trust. And in that trust, that's where you could build in language to say, yes, I know I have these children, but I want to disinherit them and I want to leave things to someone else. So that's where I would handle it. And one of the things I would say is that don't put in reasons why you're disinheriting someone in a trust. For example, you wouldn't want to write in they're ungrateful leeches, or you wouldn't want to write in that they have a drug problem or something like that. And the reason for that is, let's say they were to argue or fight you on this. For example, if they're saying that, let's say you disinherited them because they had a drug problem. Well, what if they got clean? Would they then be able to inherit? So let's say you built in language in the trust to say, I'm choosing not to leave anything to my son, Jake, because he has a drug problem. But Jake has been clean for the last year and he can prove it. And you pass away. And now the trust says, I'm not leaving anything to Jake because he has a drug problem. But then Jake could say, well, I don't have a drug problem anymore, so that language doesn't apply to me. So that's why typically we just kind of leave it as a point blank statement of, I know I might have this child. I recognize that I'm not forgetting them, but I just choose not to leave anything to them in this instrument. And so that way it's clean cut. There's no room for argument. Now, they could always still challenge that, and that's where sometimes people will leave a nominal amount and then rely on a no contest clause. So let's say you wanted to disinherit your son Jake, and let's say you have $1 million in assets. You could leave Jake, say, $20,000 and say, okay, I leave $20,000 to Jake. The rest of it goes in this direction, and then include a no contest clause to say that if anyone challenges this, like Jake, and they take it to court and lose, then they would lose out on their inheritance. So that's a slightly different way to do it, where you are leaving a nominal amount, and then with that no contest clause, you're disincentivizing them from trying to challenge the trust. Because if you just cut someone out entirely, there's no disincentive to challenge it. Like, what do they have to lose? Some attorney fees maybe in time. But if you do include a nominal amount, then there's incentive not to fight what you've done. And so those are some different ways to handle disinheriting someone, which never is an easy discussion, and it's something that our attorneys we can help our clients with. In fact, and I've seen some odd reasons stated for disinheriting, including how the last presidential election went. I actually had a family kind of looking at that as one of the reasons why someone was getting disinherited. But you've worked hard to accumulate whatever it is you have, and you're entitled to leave it wherever you want. Children shouldn't have the expectation that they're inheriting anything. A lot of times in our workshops, we'll joke around and say sometimes the best legacy or estate plan is to go when the last check bounces, So just something to think about, and it sounds like it is a tough situation, but there are ways to cut someone out of an inheritance. I probably wouldn't do it inside of a will because that only controls what's ending up in probate court. Instead, I would look at a trust as a route to do that. So hopefully that was helpful. And that's it for the questions this week. We only had time for 2. If you do have questions in the future, feel free to email us, contact@castlewealthgroup.com. Just put as a subject line radio question, and we'll go ahead and, if we have a chance, we'll read it on air, or we'll try to get back to you via email. And if you do want to ask some questions live and in person, feel free to attend one of our workshops. We have them about once a week at one of our different locations. And unfortunately, there's no stakes or anything at these workshops. We provide water, cookies, and a lot of great information. So if you do want more information on those workshops, go ahead and visit our website at castlewealthgroup.com or give us a call at 844-885-4200. With that, I hope you enjoyed our conversation this week on Medicare. I know it's tough and a little bit dry, but it's important stuff. So hopefully you learned something. You have questions on Medicare, give us a call. We help our clients with that. 844-885-4200. Take care. Make it a great week.
Learn more about Chris Berry and how he can help your family by visiting online at thechrisberryshow.com. That's thechrisberryshow.com. You can also call Chris Berry at 810-355-2584. That's 810-355-2584. This program content reflects the opinions of Chris Berry and his guests, not the elder care firm Prosperity Capital Advisors or the Castle Wealth Group, and is subject to change at any time without notice. Content provided herein is for informational purposes only and should not be used or construed as investment or legal advice, or as a recommendation regarding the purchase or sale of any security, or to follow any legal or tax strategy. There's no guarantee that the strategist's statements, opinions, or forecasts provided herein will prove to be correct. Past performance is not a guarantee of future results. Indices are not available for direct investment. Any investor who attempts to mimic the performance of an index would incur fees and expenses which would reduce returns. All investing involves risk, including the potential for loss of principal. There's no guarantee that any investment plan or strategy will be successful. We recommend that you consult with a professional dedicated to your needs. This program is furnished by the Elder Care Firm.